There we go.
Record.
I don't see it recording. I just see it live on Facebook, though.
Here we go.
There you go.
Hello, welcome everybody. Just give me 1 minute to get squared away here. We have an important topic today, and I'm very excited for it as I have the opportunity to introduce a good friend. Dr. Eric Ehle has been in the Healthovators MedFit network for a long time. He's been dedicated to really go beyond a conventional care model that is focused on getting world-leading outcomes, from regenerative medicine to functional medicine to medical fitness, the integrative elements that really can meet patients where they're at, give them the comprehensive solutions that change your lives. And we're going to talk a little bit today about another outcome enhancement, which is IV therapies. They have the opportunity to really help any one of those services that I mentioned get a better outcome, making it easier for patients to recover faster, to overcome sickness, illness, to enhance regenerative outcomes. So we're going to talk a little bit about that, but then ultimately, just like so many doctors, they have amazing services, but they don't always work. And they sit and collect dust. There's not a team that can communicate them or convert them because they're cash paying services. So we're here to have a fun conversation about IV therapies and all it takes to make these game-changing services really impact your patients' lives. So Dr. Eric, thank you so much for gracing us with your time. So tell us a little bit about your desire to go from conventional to creating a world-leading clinical model that is shaping lives for lots of people.
Yeah, I mean, of course, right out of residency, I started Well-Life Family Medicine. So that was back in 2013. And so, I mean, there was no other option. I knew that's what I wanted to do because I wanted the patients to see us for what we believed in, for what we were having to offer, versus just, coming to the doc for antibiotics and steroids. And so it was about quality medicine, not quantity. And so right out of the gate, basically, we had that kind of model of, integrative primary care more in a functional way. And so we also did regenerative medicine with prolotherapy, PRP stem cells, and then medical fitness. And so, in IV therapy, I got exposed to that back in 2006 and just saw the power that it had in people's lives, and, had some crazy exposure, in residency, of course, working in the hospital, I'd order IV magnesium for someone with a migraine, and, pharmacies calling me and asking me if the guy is in Torsades. And it's like, just a funny story. It's like, if someone's in Torsades, you can't be calling and wasting 15 minutes of time to ask me, confirm if this dose of magnesium is okay. But anyhow, it's just, of course, going from that whole conventional mindset to integrative, and the bottom line is just doing right by the patient, and whatever's least amount of harm for the most amount of benefit. But anyhow.
Yeah. So for me, we added those in Rejuve. I don't remember 2016, 2017, and I had undiagnosed Lyme's disease for 18 to 24 months. And I just thought it was because I had fatigue from traveling the world to introduce our medical fitness model to, help bring practitioners. That's where we connected in. And the stress of running multiple businesses while not taking the best care of myself with numerous sports injuries. So when we found out it was Lyme's disease, I did the functional stuff, did the antibiotics, and I would do okay until every time I traveled again. Then I would be right back in the tanks. But when we introduced IV therapies, from the vitamin C's to the glutathiones, of getting on a regimen for about 3 months, I went from probably averaging a 5 or 6, sometimes down to a 2 of like, man, am I ever going to be the same again? To this, to me, was the difference maker. And I know a lot of people, whether it's Lyme's disease, have leaky guts or a dysfunctional gut. Can you tell, maybe for somebody that isn't familiar with IV therapies, what is the benefit of being administered these vitamins or nutrients without having to hit the gut lining that you see in typical outcomes with patients that deal with autoimmune disease or fatigue or nutrient deficiencies?
Yeah, of course, that's always a great question there. And of course, people ask about why not just doing it orally. And of course, it's the whole threshold phenomenon. So, a car at 99 miles an hour, or a plane at 99 miles an hour is just a glorified car until it kind of takes off. And so that's kind of the same thing. And with IV therapies, it's really more of you're using it in a pharmacological level of basically drug level. And so IV vitamin C is a perfect example of that. You have a antioxidant dose of like less than 10 grams. And then of course you go into oxidative therapy above that. And so as a bug killer or cancer killer or whatever. And so, you just can't achieve that orally. And so that's one of the things, of course, yeah, you mentioned about gut health. And obviously if they have a leaky gut and they're not absorbing things well, and even if they are absorbing things well, the amount that we're getting in our diet is just not what it used to be. The percentage of people that are not meeting their RDA is crazy. It's about 80%, that aren't getting their adequate magnesium levels. And so, and then when we look at our soils and that it's just been done to where the content of iron is just dropping significantly. And of course we talk about spinach, the amount of iron it has now versus kind of in the 1930s. It's crazy how much more spinach we have to eat, or apples, if we're talking about other things, so just not getting the amount of levels of micronutrients that we had. And of course, then you talk about the genetic aspect of things. And so, Bruce Ames, came up with the Ames test, but, all of these genetic polymorphisms that we just may not handle things quite as well. And so we need this more pharmacological dose that we just can't achieve orally. And so, yes, sometimes you can do it orally, but it's like driving from the East Coast to the West Coast. You can get there, but I'd much rather fly than drive. And, so just get you there a little quicker. So how quickly do you want to get better is the best question to ask the patient. And, yeah, we can get you going to get today and kind of jumpstart things, or we can kind of do the slow boat to China and get you there a little longer. But
yeah, I seen some prior to, the last few years, I seen some standalones, right? Now I'm seeing the wide adoption in many clinical models, from pain management clinics adding ketamines, NAD IVs, nutrient ones for, like you said, the vitamin C's, the Myers cocktails, some of the traditional ones that you see at the drip bars. I've seen, family practices adding this from a pain, from a nutrient, especially functional medicine ones. What have you seen, especially, we're going to talk later towards the end, more of you guys have turnkey processes, not only how do you do it, but how do you make the business model work? Tell me a little bit about the type of clinics that you're seeing these introduced to now more than ever.
yeah, great question. Of course, obviously it is a moneymaker, or it can be. And so you got the clinics that are adding it for the ancillary revenue. And so, of course, I think a lot of people just want to help people. And so they see it as a service to, get patients better quicker. And so, and of course it's kind of a win-win. So you can help patients plus help the practice. That's a pretty good service. Obviously when I first started doing some practice coaching with you, one of the first places you start is you talk about reverse engineering your goal and, what are the ways we can grow the business? And so, figure out where you want to go first, and then, figure out how to get there. And so, there's three ways to make more money in practice. You can either see more patients. That's not my model. I don't like that. I like quality, not quantity. You can either do more. So that's kind of what we've done and I have a little bit of that shiny object syndrome. So, some of our services collect some dust, like you mentioned, but, we have like over 30 ancillary services with hyperbaric and sauna and infrared, kind of all kinds of different things with, or you can charge more. And so if you're in the insurance-based model, you can't charge more. They cap you out. So if you're cash-based, you can ramp up your charges as much as you want. But, that's the three ways. And so again, we're talking about IV therapy as being one of those ancillary revenues that, again, if it's depends on, you can obviously do it yourself. And, a lot of people can, it's not that hard to throw together an IV, but, it's the legality or the liability, you want to make sure you do it right. And so I always recommend with any new service that you add to the practice, do it right. You save your money ahead of time, by getting a mentor or someone that's already been there, done that, learn the hard, lessons there. I've of course experimented a lot of these things on me, and, so doing chelation and then going for a run later and my muscles cramp up because I don't have enough calcium in my system, and it's, or doing UVBI and I start, having some hematuria after a few rounds because the nurse gave me a little too much heparin or whatever. But So, again, learn from someone that's already done it. And of course, there's basically 3 ways to grow a business. So we talk about finding new patients versus, getting patients to spend more with you. So again, if you already have an established practice, adding on IV therapy is a great way to grow. Now, having the dedicated just IV bars, that's a much harder model. And so, especially with COVID, one of those things that we've seen with COVID is learn to diversify. That we knew you have to have, don't put all your eggs in one basket. And so you never know when, you may not have that revenue to depend on. And so, but it's a great way to build to the practice. And that's what, and of course, we focused on the therapies that are most beneficial to patients versus we don't go for not everybody needs IV therapy. It's some people, can just do it orally, but for the right person, it can make a big change for them.
I love what you said right there. Reverse engineering a successful business model. And if you're listening, the one principle that's going to make you feel the most fulfilled and going to take you the furthest, especially when you're not a quantity model, is successful patient outcomes. And, you can use the cutting edge therapies, regenerative medicine, you can use functional medicine, but if you don't get that patient healthy or bought into the behaviors or have the tools that help, the IV therapies are one of those that to me are a catalyst to outcome between the direct nutrients to the body through IVs or dealing with the emotions or matters of the heart. That's the thing where I see chronic pain, reoccurring injuries, the disease of undealt emotional issues, lifestyle, and nutritional deficiencies. So this is one of those things that if you have an integrated practice, this is going to help you get good outcomes. And we can move into the conversation a little bit, just like you brought up those business mentalities, as where I see many practitioners, unfortunately, is they are in a transactional model that is not that much different than an insurance-based model, just with different services. But now it's more complicated for them to do this because this is coming out of the patient's pocket versus the insurance covering those transactional services. So, even over the last 2 years, we had enough volume where we could upsell and we had case managers, but not all the practitioners have that or can grow like we have a Rejuve or went, and spent years just like you in business masterminds and coaching, doing everything that you go. So I found helping them sell transformational programs that don't take the doctor's one-on-one time are really important. So how do you sell them a year program or a monthly membership or the ultimate transformation that may include 2 regeneratives, a monthly IV, every lab test, and you're selling the $10,000 to the $20,000 transformations, because ultimately if you do one IV, one PRP, that may take someone there, but then you have to resell them over and over and over again. And that's just the shift of where I've seen good integrated practices go from good to getting better. So can you tell me some of the challenges that you have seen for other entrepreneurs listening, that, the importance of having the right team, the right message, the right branding, the right, emails, autoresponders, all the stuff that you've learned over the years to continue to incorporate, and why your service that we'll talk toward the end is trying to do most of the heavy lifting for the practitioners?
Yeah, of course, our biggest overhead is our staff. And so, and of course, finding the right team. We have a really great team right now, which is awesome, but we haven't always had that. And, of course, the whole saying, hire slow, fire fast. Of course, I think I need to take a lead from you and, of course, handling family situations there. And when you have to let your brother go, but anyhow, yeah, it's, and so when you talk about, of course, investing in yourself, you are going to be the best investment you can make. As of course, obviously, you can look at some of the different, of course, if you buy your building and other things, but the amount that it takes to learn a new skill and doing it on your own versus just finding someone that's already kind of been there, done that. You can save thousands of dollars, of course, just having like a turnkey plug and play, get you going right off the bat. And, if you have any of those options out there, please let me know, because I'm ready to spend money there, because it's just makes sense. It's like an ATM versus, definitely wanting to find someone that's already gone down that road versus having to reinvent the wheel there. It's not much fun, but
Yeah, it's so important. It's unless you have the time or the patience, look at athletes. The highest paid ones get paid in the draft the faster or more powerful they are. And it comes down to, can you do this on your own? Can you go slower? Can you create this playbook? But why? When you can go a little bit faster with business models that have a system that works. And I've rarely seen anybody do better by going it alone without coaching, without a system of some sort. And that's why I'm bringing you on. I love that you have something that's been proven, that's worked, that you as a team have looked at so many of the different elements to put this in, because I have seen practices try to do the IVs and be not profitable ever, or not that it doesn't get good patient outcomes, but then it's hard for you, is if you're running this independent practice, to show up for your family, your patients, if you're not profitable. And that's what kills me in these independent practices is I know they're right, but yet the doctors are making less than what they would have if they'd have stayed in the conventional model. So it's more stress, it's more added times. So, really, like you said, investing in yourself, learning how to go from beyond a doctor to even functional and regenerative as extra training. How do you balance the educational of learning how to run a business that isn't about manipulating your patients? It's about getting a better outcome. It's about a win-win-win for you, your team members, to have a professional place that they can grow in for the patients. We want everybody to win, because the other system is fixed. It's fixed to burn out doctors. It's fixed to keep patients unhealthy and not optimal. It's fixed to make the pharma, the big people, the big money, but it's not working for everybody. And that's why we're in this chronic pain and chronic disease crisis. That's why we're in a unhealthy nation. That's why there's the doctor burnout and suicide and people unhappy. So it's making these integrated practices win, win, win. And you know what it takes. You've been through the rigors of making it all work. So if could even go back, knowing what you know now, would you have taken a different trajectory? Would you have, and I know you've been in coaching and masterminds, what would you be telling doctors that are either thinking about leaving the conventional? What would you tell, ones that are in it right now and not quite where they need to be, how to understand this is more important than ever for consumers, the people, to make healthy? This is what you guys went to med school. How do we save them the problems that many practitioners that go independently have went through?
yeah, of course, obviously we're in, the misnomer. It's not really healthcare, it's sick care. And of course, again, whether you pay, upfront, with insurance versus in the end, it's of course ultimately the patients that pay in the end. Obviously insurances will cover the bare essentials. It's kind of like car insurance. They won't cover your tires or anything else that's, is really necessary. But the key there is, and what I'm trying to learn is, to do what only I can do and outsource the rest. I brought on a scribe this year, and it's one of the best decisions I've made in practice in the last 7 years. And so for those doctors that, of course, maybe, wanting to get out of conventional medicine and going doing their own thing, of course, yeah, I definitely would have done things a little different. Hindsight, 2020 is definitely. And so that's why, of course, one of the reasons why we started the IV Therapy Academy is just to been there, done that. I've gone to a lot of different IV therapy courses, but the problem is there's lots of good courses out there, but information without implementation is not very helpful. And so there's tons of informational courses out there, but until you actually know how to implement it and A to Z, that's the biggest difference between. And so when you're looking at learning new skills or finding out ways to grow the practice, really for me what's important is, well, at bottom line, at the end of the day, how can we implement this? And again, how do we reverse engineer it? So it always goes back to that. And so I like the entrepreneur operating system as well. And so talking about like delegate and elevate there. And so again, that's a great model for kind of the business side of things, of just focusing on what's important and urgent first, get those taken care of, and then focus on what's not urgent and but still important. Those are the two things to kind of be focusing on. And so we talk about our quarterly rocks and trying to, again, just focus on those, stay, hone, the kind of laser focused on those just couple of topics for those 3 months versus, of course, again, I got that shiny object syndrome. And so you get your cell phones, they're dinging, and, it seems urgent, but it's not really important. And so we get distracted. And so I think a lot of times with people that are starting new clinics, we get distracted very easily. And so trying to just stay focused on what's important to you, and so again, what drives you is always the key. And so figure out your why before you figure out your way is, and so work-life balance, one of the things about me is that, yeah, I mean, I love what I do and it's my passion, it's my calling in life, but it's definitely, being in private practice is not the easiest. I would much rather just get a paycheck, but that just is, I would get I would lose my vitality if I did that. I mean, it's like selling my soul. But, bottom line again is, how much revenue do you want to make? Who do you want to serve with your clinic? I mean, do you want to change your community or change the world? Do you want to, stay small or grow big? And one of the things that I've learned, and of course, when we started off with coaching with you, of course, it's always like, oh, where's your autoresponder and where's your, landing page and, this, that, and the other. But, I think we shouldn't feel shamed into thinking that we have to grow our business. I think that some of the businesses that grow and continue, they actually become less profitable and create bigger headaches and provide worse services, that we really just need to, figure out our why. And, just because you're not growing doesn't mean there's something wrong. We have to be conscious of the decisions that we make to grow our clinic and to what degree. And we should be optimizing for better, not necessarily more. But just figure out what's right for you and just do some soul searching, and whether that's staying with your current model and trying to bring services to the clinic that you're already in versus branching out on your own. And the grass is always greener on the other side. There's always gonna be headaches and things to deal with. And so, instead of, just change your perspective on things. It's like stress. Stress is the interpretation of the stressors. You can't change the stressors. I mean, again, there's going to be things you're going to deal with, but you can change your stress levels. And so that's kind of the key, is just change your perspective, to change your life.
That's so important. And you dropped some major wisdom while being very transparent and vulnerable. So thank you so much for that. I will summarize it. Number one is, what is right for you? Less is sometimes more. So meaning, do you want to change the world? Great. You better be ready to climb some mountains then. That's what I recognize. My mind was change the world, change the world, change the world. But yet my health, my wife, and my children were suffering. I chose that. So it's just like, okay. And I'm not saying balance, because when you're an entrepreneur, there are some sprints and there are some different things right there. But I had to redefine what I ultimately wanted, which was to travel the world with my family and to see beautiful things and use my best gifts, which were speaking, consulting, and strategizing. So I had to start learning to say no to the 75 business ideas that people, because they knew as an implementer, which goes to point number two, is clarity. When you have clarity of vision, and your why is, what do you need to have focus on? Here's the plan that's reverse engineered that's going to get you there. And you mentioned traction EOS. There's going to be a lot of stuff, but what are the most important things to get you there, so you can say no, or you can say next quarter, or if it does become the most important, you can substitute something. Because if you are in stress, that means you're usually not clear. You're not focused. You don't know what to do if you're in anxiety or fear, versus just knowing you can just show up and do what you can do in front of you. So that action can alleviate anxiety if you know what that action step is. And then what we've all had to learn to become, if we're going to be entrepreneurs, is delegators. Just like you said, the importance of the team members, them knowing your vision, your plan, having some structure, core processes, something to develop in there. That is really the secret sauce to being an entrepreneur, is you can't do it all. You're supposed to do what you do best. You may have to build it and put some time into building that structure. But when you can have a team that does what they do best and is on the same page with your vision, magic things can happen. So thank you for all of that. you have maybe a few slides that you can show us about the IV therapies, which kind of talk about this? You have a team of people that have developed the infrastructure, the marketing, the tools, the resources, and there's a couple different plans, not only clinically trained how to do it, but how to implement in this, you're the business, because most practitioners, if you're going to be the one-to-one care, then you're going to need an implementer, a delegator, or a proven system. Otherwise, you're going to be challenged. You're going to be challenged no matter what, but we want you to succeed in your challenges, to climb a mountain and have some victories. Take your breath, walk your way back down, climb another one.
Yeah, it's that's again, of course, our focus is the implementation of IV therapy. And so of course, ivtherapyacademy.com, of course, we offer kind of a free trial 2-week period that has some of the different order sets, the history, the intake forms, the informed consents, all of the kind of infusion record stuff, and kind of gives you a little sample of what we have to offer. And we have the full version with the business aspect, so it even goes into some of the marketing stuff. So sample operating agreement. So again, obviously one of the biggest questions we get asked is, we have actually nurses and nurse practice that want to start up an IV therapy practice, and so they have to find a supervising doc. And so having that operating agreement, and of course, even maybe you're on the other side of things, and you are the MDDO or something starting the practice, but we have job offer letters, non-compete agreements, and subcontracting agreements, and job posting, and just all the business stuff. We do twice a month live Q&A sessions to, again, just work through that together. We have a ton of different protocols. I think about 30 different protocols, just some of the more sought after protocols, and all of the different topics that we talk about there. And of course, part of a bonus is for signing up, we give them a full business plan. So again, just figuring out, again, reverse engineering where you want to be at. And so projections are super key there, and making sure if you're not hitting your targets, why is that? Again, reverse engineer it, and so that you can hit your goals. We have an optional kind of additional purchase for policy and procedure manual. And so I can't tell you how many clinics actually have one of these. I mean, because it's so rare, because we just kind of, it's just a necessary evil, but no one really wants to do it. But, legality wise, if you were ever to get audited, if they're the first thing they're going to say is, where's your policy and procedure manual? And so if you don't have that, this kind of CYA, I mean, you can be up a creek. And so it's a really important thing. And we've already done all the hard work for you again. And so, do what only you can do, and outsource the rest. And, we're here to kind of try to help outsource this, some of that stuff for you, and get your staff trained up. And, we were, of course, talking about some of the staffing, and how costly, staff is. There was a crazy quote by, let's see here, I have it written down here, Brad Smart, by Top Grading. And so a mishire can cost you 13 times the base salary of that position. So say the base salary is at $75,000, the wrong choice could cause you about $1 million of lost time, money, and productivity. And so it's so important to find the right people. And, when you think about the cost of, a program like this, it's pennies. I mean, again, it's a third of, you're hiring someone for $15 an hour. How many good employees can you find for $15 an hour? And that's just a month salary there. So, invest in yourself, invest in, and whether it's IV therapy or any other service. I mean, again, the bottom line is, it doesn't, if IV therapy is not aligned with what you're trying to do and accomplish, that's fine. And again, it's just, and so, do your soul searching. But if, it can pretty much, of course, plug into kind of any model, whether you're an OB-GYN or pain management. I mean, we offer ketamine in our office, and that's been a game changer. I mean, there's some stigma around that. And so I was a little hesitant at first. Casey, one of my colleagues, that's also one of the co-faculty members of IV Therapy Academy, she started offering it in 2016, and it wasn't until 2018 that we started doing it. But I had a patient that committed suicide when he was on the phone with his mom, and both of them were patients of mine. And it's like, oh, it's just, it's heart-wrenching. It's like, could I have done anything different with that patient? And that was one of the things, that's what molds and that's what shapes my practices. And so in the stats with ketamine and suicide, and being able to get someone out of that deep, dark hole, I mean, that's powerful medicine. And of course, then when you start looking at pain management, and so we're talking about, of course, people with chronic contractures, and then all of a sudden they can move their hands, and just giving them the first time they've been pain free in the last 20 years, that's powerful medicine. And so being able to offer treatments like that, that's
I have.
powerful.
I wanted to touch on that because so many people stop because this isn't their realm of comfort, knowing, or understanding. Yet so many doctors are the most educated, most learning, but then we create this bias. But we know how to evaluate, right? Or we would hope. But is that patient getting any better? Is the insurance solving their problem? Are they able to do the things that they once would or love? Or can they even communicate if not? If not, then the plan should change if we know it doesn't work. We've heard the definition of insanity, so I won't insult anybody. But I've been in those clinics, in the pain management, in the family practice that they're doing this now. And it's a game changer. Just like you said, 20 years of depression and in chronic pain done and back to doing the things that they love. I like trying everything, as I've been a human guinea pig and I've had my own chronic pain. And as of this September, the first time in 15 years, I'm not out of pain. And since I was 12 and I had my traumatic experiences, is I needed some form of sedation, which was sports, which was work, which was drugs, which was cannabis at one time. I'm completely substance free, managed emotions, unreactive. And the ketamine clinic was the kickoff for this for me. I was able to trace right back to my 2 early childhood traumas where this happened. It was the catalyst to the transformation that I've been going through the last 2 years. And my family's thankful for it. They're now asking. I've literally changed my wife's, my children's life, my life, because of these things that some people just immediately shut down. So all I ask for anybody in the healthcare space is, this is the one place where innovation is usually poo-pooed upon. That yet everything else, technology, cell phones, infrastructure, cars, vehicles, everything's like growing at this pace that we're accepting, but healthcare, it's just like immediately frowned upon. And I'm not doubting that we don't need more research and more continued outcomes, but look where most of the research is. It biased? Is it paid? Versus just how do we get patients the best outcomes? And thank you for being willing to be open, for the regenerative doctors, for the functional doctors, for anybody out there that just knows there's more for your patients. This is what the world needs, is just somebody to look them in the eyes and say, I have hope, I have belief that as long as you're willing and to take a step, there's possible solutions for you. And that's all I can ask, is great doctors just like you that are willing, that are open, that want the world to live in a better place. And ketamine is something that is a game changer that I've seen.
Yeah, it's of course, again, when you're in a deep dark place, it takes a big gun to kind of get you back to doing good. And so NAD or some of these other therapies, I mean, we do a lot with Alzheimer's and dementia. And again, for someone to start talking and doing things for the first time in 20 years, that they finally actually recognize their husband, spouse. And I mean, again, when you can just give that back to someone, again, it's just so powerful. And so talking about, of course, responses, and so obviously we always love the wins. I mean, that's awesome. Again, you get the positive response, oh, keep going. I mean, again, you're on the right track. But what happens if you don't get any response? Well, maybe the IV therapy wasn't right for them in the first place. Maybe you need to increase the dose. Maybe you need to change it to a different formula. And what happens when they feel worse? That's always the one that's a little bit difficult, but that can be because they have more of a physiologic shift. Maybe they were dehydrated. What's a misnomer is, people are getting these IV therapies, but the IV therapies are actually a little bit dehydrating. Most people, the osmolarity is actually too high. And so you have to, of course, usually we'll use sterile water to keep the osmolarity a little more isotonic, but sometimes you actually have to just give them a little more fluids, or maybe they're a little dehydrated beforehand. So just making sure that they're drinking water afterwards. There could be an immunological activity. And so, of course, obviously it can activate the immune system. They were so sick that their immune system just didn't know how to handle things. And so then you just gave them rocket fuel, And so, they're going 60, 0 to 60 in 2.5 seconds. And it was just too fast for them. They weren't able to handle it. And so, you may be able to, you may slow it down a little bit or decrease the dose, and get some pathway activation. So again, obviously your body may start killing different bugs, and you may, be, again, just, supporting their immune system in that way. And so sometimes if you can just sometimes work through it a little bit, and if they can tolerate it, you may just, after a few IVs, that kind of a Herxheimer detox, whatever reaction may clear up. But none of those things are a bad sign, whether you're getting good responses, no responses, or worse. It's just feedback, and that's kind of the key. There is no such thing as failure. It's, again, it's just feedback. It's everything looks like failure in the middle. Whether you're baking a cake, my wife hates me to be in the kitchen because it's going to be a disaster. It's going to look like or you talk about being in surgery, it looks like a murder scene. You got blood everywhere, or going to the moon, and again, you're constantly having to course correct, and that's the key. Is whether you're trying to lose weight or help someone's health or whatever, it's course correction. Did this and the outcome was this, and so if it ain't working, change it up. The proof's in the pudding there, and so the key there is just working through things. And
I love that you said that, because sometimes one failed regenerative, it gets a bad rap, or the IV didn't do it, or there's a bad reaction. But show me the other side. Is there not infections in the joint replacements? Are there not bad surgeries? Are there not deaths with thyroid medication management? Or, all these issues happen every place. And I'm not saying that that is great by any means. What I'm saying is you gave the best analogy possible. Is if anything is not getting better, they're still wanting a solution, but they may get worse in every other situation here as well. What we can't do is give up. We are course correcting. We are trying. There's so many things. Meaning, when I did my intranasal stem cells because of the Lyme's disease, trying to take it to the next thing, I was in the ER the night after. But guess what? That's baking up that biofilm. I had a reaction. I came out better a month later. So I could have said, oh, that's bad, and never do anything like that. But just like you say, I'm seeing intrathecal stem cells that are helping people in these neurodegenerative clinics have game changes or stop the progression of these horrible diseases. And, people want to look in these cash cares at the one thing of why we shouldn't go down this, versus show me the other side of all the amazing things. But the other side I want to position right back to you is, that's why I'm so thankful that you're helping run these programs. I know I go to a lot of them where sometimes it's nurses, and there's nothing wrong with there. You're a doctor that is helping educate, be a part of these live events, and really explain the education, how to optimize, how to hydrate, looking at, based on your clinical experience that is huge, of how to do these safely, effectively at the highest level. So can you break down the two different offers of what you are including for these clinics when it comes to IV therapy? And I don't know if you have a slide or two that you can show, but I want you to go, because this is the best course that I've seen in terms of not just how to do these, but the ongoing training, support in the business in a box system that saves you the time. The doctors aren't the implementers. We want you to connect with the patients and prescribe it. We want to make everything else as easy as possible for you.
Yeah, so I mean, I hope if anything, just kind of inspired people to do a little bit of soul searching. And again, of course, the worst thing you can do after hearing something like this or going to a course or whatever is to do nothing. I mean, again, information without implementation is not very helpful. And so, of course, I would encourage people, don't experiment on yourself and patients. I mean, you want to know what you're doing, and so get trained. Get taught correctly with whatever you're going to do. Don't reinvent the wheel. Of course, I have get into a little bit of analysis paralysis at times, but so you kind of have to do, ready, fire, aim sometimes. And of course, sometimes fire, 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 and, the whole West Texas shotgun approach there. So eventually you'll get it, but,
somewhere in the middle, both of them,
yeah.
always somewhere in the middle is the secret sauce.
Yeah, but we have two offers when we talk about our kind of main IV Therapy Academy. And so we have, our full version with the business. And so that's typically is, I think, $14.95. And that just has all the bells and, huh?
It's literally a steal. It's like a no-brainer. It's incredibly affordable. I was literally blown away. And, that is serving the world's need at an important time. So, it's literally, you can't find anything better.
Well, the key there is, one patient pays for it. I mean, that's all you need. And so, I mean, when you think about it in those terms, return on investment, it's astronomical. And so it's like printing money if your goal is more the business aspect of things. Of course, again, obviously you got the patient benefit of things as well. And so again, it's a win-win-win. And of course, and if you can obviously take some stress off yourself where you're not having to produce all the revenue for the clinic, and some of these ancillary services can start helping you out. That's kind of the key there. But yeah, we have kind of of course, a comparison on our website. And so if you're just, maybe you don't need the business stuff, you're already kind of set up, and the marketing ins and outs, and, again, you don't need all of that, which almost everybody could benefit from some of that stuff, but we do have kind of our light version. And so the light version, is $997, I believe. Now, both of these, of course, come with CMEs, and so obviously everybody needs some CMEs, and so might as well, again, add another ancillary service. So that's the difference. You get 14 and a half hours for the light version, and 25 and a half hours for our business full version there, and kind of that just more turnkey. And we keep updating and optimizing, with feedback from our students. We have over 600 students right now, and so we've been doing it for the last 3 years. And again, we created this course because out of need, because there was no other course out there that I could find that was offering the things that we were offering. Again, there was great information out there, but the implementation, some of the courses did have a few forms here and there, but as far as all the different recipes and just making it as easy as possible, A to Z, there was nothing else out there.
In the support,
in addition to that,
calls.
the support, exactly. So twice a month we do live Q&A sessions, and again, and there's 3 of us on the call. There's Jason Duprat, myself, and Casey Devine there. And so, I mean, the being able to harness 3 people that have been there, done that, and not only, of course, for IV therapies, but for just business in general. And so we're in the trenches. This is not, and so again, the ongoing support there is just priceless. And so versus, you can get the information and just try to do it on your own, but you got to problem solve it. And again, you're going to run into things, and so just knowing how to deal with those situations. It's always great to stand on the shoulders of giants, and of course, and use what we have, the experiences we've had, that you can then pass on to your own clients and patients. And
it's the best deal in the market, because when we started, we had to send and travel and go do all that for the training, and we didn't have the ongoing support and the turnkey system. There was some competitive advantage, which was great, and really thankful for how we were trained. But from affordability, even if, like you said, you're not going to even do this, the CMEs to do the low product, to get the coaching, to know how to refer if you are a practitioner and want to get your patients to a different place. Because even if you learn how to refer and collaborate with people in your community that are doing this, you are going to create a relationship, which we talk about all the time. Create your health network to get your patients, the physical, the mental, the internal, the emotional, of being the quarterback of care that is solving your patients' problems, because this is what the world needs. And you need outcome-focused, heart-centered practitioners that understand it and are trained in it. And Dr. Ehle is one of the best, one of the elite. And I think this is just the best deal that I've ever seen in terms of a turnkey business that can have an outcome-focused impact at this type of cost. So full endorsement. I know the training and how he shows up for the years. I think what you're doing is spectacular. So thank you so much.
Well, thank you for having me.
Yes, my pleasure. So jump on that link below, at least do it yourself and review everything, and jump on it. This serves the world need right now. Or tell a practitioner or two, because there's so many other courses that are 5 times more expensive and do not have what this has from the comprehensive and the ongoing support. So I just think it's incredibly, incredibly a wonderful opportunity. So happy to be able to share that with all of you. So thank you, Dr. Ehle. Appreciate you so much.
Yeah, good seeing you, JR.